Hello, everyone, and welcome to our proposal on the health services offered at Utah State University Logan Main Campus. My name is Sidney Brown, and my partner's name is Mason Smith. So, a little bit of a brief introduction as to why the mental and physical health of students is so important. And this is due to the fact that both the mental and physical state of individuals will impact their academics on a day to day basis. So, both of these are vital to a student's academic career and success and are equally as important as each other. I am Sydney Brown, and I'm a major in nutrition and dietetics, with my associates also in nutrition and dietetics. And with that being said, I have a lot of access to various inside information about the physical and nutrition options that are available on campus for students. And prior to this semester, I had a full-time job at Lifetime Fitness, so I was exposed to a lot of the physical aspect of things. And my partner, Mason Smith, she's a psychology major, and she has attended mental health sessions in the past and has actively sought services on campus, but she has only been met with a lack of information in the specific areas she was searching for help in. With that being said, since she's a psychology major, she has access to a lot of general information about mental health services that are offered around campus to students. So, there have been a lot of questions asked about this topic, such as, are there places on campus where someone can get help if they need it? If so, where are these places located and how can they be accessed? Or if a student needs help in one or both of these areas but can't afford it, how will help be received, or will they even get help? So, the purpose of this proposal is to limit, if not fully eliminate, these questions, and this will be done by drastically advancing the health services that are offered to students at Utah State Logan Main Campus, and hopefully once the issue is resolved at the main campus, it can be expanded to the other USU regional facilities. Currently, the mental and physical health services offered at USU are insufficient and somewhat unattainable. Some of the problems that have arisen regarding the physical aspect of things is that physical activity, while it is a necessity for students because it's beneficial academically, there is not enough access to professionals, affordable services, or promotion of these physical activities on campus. And as stated by Colorado Technical University, physical activity helps with heightened focus, lower stress levels, increased energy, and sharper memory. Since students transition to college from the home life and high school atmosphere, there has been a reported drastic decrease in physical activity since they started attending college, and this was shown from a study done by the International Journal of Exercise Science. This proposal will hopefully help to decrease this and make it less drastic if implemented. The academic performance of students is in direct correlation with the physical activity in which they engage in. Some problems that have arisen with the mental side of things is that mental well-being is equally as important as the physical activity side of it to benefit academically, and currently there's not enough access to professionals, affordable services, or promotion of mental health options. College students are more stressed now than ever before with school, work, relationships, and living expenses. 55% of students nationally make this claim that college is their biggest stressor in academic nature, and this was proved by a study performed by New York University. Because of this lack in professionals and staff available for students, not all students who need help are able to receive it. The solution that we propose to better the physical aspect of things is to increase the accessibility of information, the affordability of resources, and the qualified staff that are available to help students. The first thing we're going to focus on is the physical health activity and promotion. This is essential because students need to be able to know about the resources that are already available to them and the things that will be available to them. Our solution is that they be promoted with emails and messages from the university that can be accessed either online or your phone, posters to be hung around well-trafficked areas of campus, reminders on Canvas as it is hopefully used every day by every student at Utah State, and incentives for students to work to become physically active. So this will be like a point system. For the point system, kind of what we were aiming for is every time a student went to the gym or one of the gyms on campus or engaged in a physical activity, they would get points that would go towards getting free classes or getting different free things that would usually cost money. Second thing is the affordability of physical health resources. Most students on campus rely solely on a budget to survive while in college, and USU offers like low discounted prices, but those who can't pay for it are not able to engage in the physical activity they would be able to. With that, our solution is to make these things completely free or included within the $600 student fees that we all have to pay prior to the beginning of the semester, or for them to be made much more affordable for a wider variety of students so that more students can be engaged in these physical things. And finally, in regards to the physical side still, we want to focus on an increase in the availability of professionals in the physical health field. So that even includes nutrition. With more affordable services, more students will want to take advantage of these things, which means that more staff will be needed, at least initially. Nutrition is also very important because without the proper fuel, a student cannot reach their fullest academic potential. Our solution for this is hiring more physical health professionals and making them more accessible. So that's like personal training, dietitian, and making them accessible to students so students know where they are and so they're close by. The next thing is providing an accredited online resource that will allow students to eat healthy on a budget so that they can actually retain the proper fuel and not need to go see a dietitian or get health advice all the time. Instead, they have an online close source that they can go to if they need help. The graph is just depicting the barriers and enablers to a healthy diet. So the three different things are the individual level, which is the food preferences of students, different health activities. The middle one is university environment and how important that is, and the social level, so what are their friends eating and whether they eat in or out, which is important in terms of this whole accessible online resource.
To improve the effectiveness of mental health services, we suggest Utah State increase three things in its current system: the accessibility of information, affordability of resources, and qualified staff to help students in need. We suggest USU implement discussion panels or role-play opportunities to allow students to more easily share their feelings in groups. A biweekly newsletter should be sent out to provide awareness for mental health services and to poll students on how well these services work for them. An increase in homework tutoring sessions may also help students receive the services they need, since a large amount of college anxiety results from confusion over homework. Unfortunately, many students cannot afford the services USU currently provides. We suggest free mental health screenings for students, along with access to additional resources such as free meditation training. As of spring 2020, 9 licensed psychologists currently serve USU's student body of 27,662 individuals, but the range of racial, religious, and sociocultural backgrounds is limited. Students often do not know which therapist to turn to when they are struggling with very personal experiences, or whether they get a choice at all. Helping students find the professional right for them will significantly reduce anxiety and prove much more effective than simply assigning students to a psychologist based on their major or last name.
The inclusion and implementation of the things stated in this proposal will be outlined in the budget cost by the following: improvements in information distribution and advertising, hiring more mental and physical health professionals, opportunity for more services to be free of cost for students, increase in the methods of assessing health services on campus, analyzing the data gathered from assessments to make continual improvements, all allow for the inclusion of these aspects, which will be about $8.8 million annually. This number is based on our research via the American College Health Association and USU's previous reports. The majority of these costs will be in the early years of the implementation of this proposal. As more personnel are hired, costs will be refined over time and will eventually decrease. The university will benefit from this proposal by seeing better academic performance in the student body, higher graduation rates, better accreditation and federal funding, as well as private funding for programs such as these. And here are our references.